This is a before and after of a Restylane filler injectable, hyaluronic acid filler. And you can see that there's quite a lot of lower face stuff going on in the before, and it's fixed in the after. What can we see? Smoker's lines or barcode lines? You know, like the barcode. Okay, there, barcode lines. What else?
The jawline.
The jawline, yes. The pre-jowl sulcus is that dent over here between your jowl and your chin. As the face drops, it's not that you grow a dent. You don't grow dents. You know, not like she's lost a bone there. Maybe a little bit. The issue is what? Why did that dent come over there? Because the face dropped. So the lower face, the lips are anchored in the lower face, but the lower face is determined by the upper face. If our upper face didn't drop, our lower face would look peachy. So you have to see it all relative. Somebody walks in and says, "Doc, fix my jawline." There's a whole lot of dynamics going on. That if you just plunk some filler in there, good, but better if you lift the corners and you lift the cheeks and you do the whole facial rejuvenation. She's had in her lower face, upper face, yes, but what's going on in the lower face? Yes, you can see the lips, you see the edge of the lips as being rejuvenated. Nasolabial folds, yes, those have been rejuvenated with filler. With these guys, sometimes they're called marionette lines. So that's why the marionette line is very popular for putting in hyaluronic acid filler. That was one of my patients. There is that jowl and marionette line, also known as the oral commissure, OC, which is more this top part of it. And there it's been filled nicely with the hyaluronic acid filler. Party hat lines, who's heard of those? Because if you were to wear a party hat, then you would have a string coming down like this. See the string? So we go back and we see the party hat lines have been filled gently with Restylane. Probably with Restylane fine lines, the very fine one that we can put like as a netting underneath the skin, and like a sheet under the skin rather than a clump somewhere. And it's very soft and smooth and it spreads beautifully with our new technique, the cannula technique. Golf ball chin. Very important part of the lower face. Yes? Neuromodulator. Who knows what a neuromodulator is? Botox, Dysport, Zeaman, those are the number ones. See that muscle? One that pulls up here? Some people when they talk, it puckers, and eventually, you do this a lot, you get more lines there. So you reduce it by putting a Dysport in there, or you fill, and filling changes the shape. And I'll talk later about changing the shape from a square face to a V face, which is the ideal of feminine beauty.